Hi, I'm Carrie Rosamelia. I serve as the director of the Central New York Regional Office of the AHEC system. I am housed at SUNY Upstate Medical University in Syracuse, New York. Upstate was one of the founding institutions that created the AHEC system, and I feel honored to continue the legacy of supporting rural communities across New York State. The AHEC system supports my mission, which is to identify, recruit, and nurture medical students who are interested in future small town practice. This slide shows our rural medicine elective course offerings from across a 4-year medical school curriculum. Students who take designated courses and complete a capstone project in their last year of medical school will receive a micro-credential in rural medicine. It's the first of its kind, and we think of it as a concentration in rural medicine. The micro-credential is a culmination of 5 years of strategic planning, which I could not have done without the support of the AHEC system. And what I mean by that is that AHEC offers a community of others who are invested in the same academic world and the same work as me. So during our in-person gatherings over the years, I have always left feeling more creative and optimistic about what I can achieve in terms of strengthening our path of future rural or small town physicians. In year one, we hold monthly sessions focusing on the challenges and benefits of the rural healthcare system. We often focus on vulnerable populations, inserting an asset model approach to describe small town life. For their final project, groups of first-year medical students are teamed with small groups of high schoolers from across the state to learn a clinical case. The high schoolers compete in a case competition each spring. During the competition, high school teams are asked challenging questions about the case, and the winning teams receive gift cards and a plaque for their school. AHEC funds allow us to bring in speakers for the monthly sessions and host the case competition with the high school teams each spring. Additionally, the Buffalo State office is put to work during the case competition, often serving as competition judges and session timekeepers. We appreciate their active support of our programming. We know that while many of our funding agencies are valuing pipeline programming less, our state office remains committed to programming that brings in young learners and offers medical students a chance to become educators and show off their growing knowledge of patient care. During their first summer of medical school, or what I like to refer to as the last summer off for the rest of their lives, rural med students can select from one of 3 elective courses. I'm highlighting just one, the Rural Immersion Week. During Rural Immersion Week, 12 to 16 students live and train for just 1 week in a small town. We specifically focus students on sending them to North Country sites where the need for physicians is substantial and the hospitality and red carpet treatment towards our students is unparalleled. Hospital systems use this type of program to showcase the benefits of small town practice, and they follow our students through their careers, offering them positions after residency. Students are offered dinners with doctors and individual hands-on clinical mentorship throughout the week. They often return to these communities in their 3rd year for additional training. AHEC funds are utilized for these experiences. They support student lodging and other costs. And furthermore, we receive assistance from NAHEC and CNY AHEC to deliver immersive experiences. Moving on to 2nd year, I'm so proud of our new course. Here we team about 7 students with 1 community physician and 1 community patient who is a patient educator. The students come to learn about the patient's life and the journey through their healthcare system through 3 specially designed course sessions. In the spring, students will present their patient stories at a university-wide forum. This will be our first annual Rural Medicine Symposium. AHEC funds would be utilized to support the contributions of our 5 educators who are directly impacting the education of our students. If offered, we would also utilize AHEC funds to provide our community and patient educators with a small stipend for driving and perhaps even staying overnight, depending on how far they live from our campus. We would also like to use funds to host our symposium and be able to open it up to a larger audience. So this brings us to our third and fourth year. In third year, students are training for 5 months at hospitals across New York State. AHEC supports callback sessions where students discuss their clinical cases that they've seen in their offices, and they discuss these with community preceptors and their peers. These teaching sessions are critical to the mentorship of future physicians, particularly in the field of primary care. And in fourth year, students are well prepared to teach and mentor freshmen and sophomore medical students. They facilitate first and second year instruction and deliver presentations again at our first annual Rural Med Symposium, which is going to be on March 16th. Yes, this is so nice that I am actually mentioning it twice in one presentation. We've always wanted to showcase our students and offer an event like this, so we're pretty excited to do it. We seem to be a bit of a hidden gem and hope that an event like this will bring needed attention to the importance of rural medicine, primary care, and of course, the good work put on by the New York State area health education centers. In conclusion, I am able to provide critical experiences for medical students in communities most in need of physicians. Because of AHEC, exposure and mentorship are the keys to recruitment of rural physicians. And through AHEC support, we are indeed supporting small town communities. Thank you so much for the opportunity. Please reach out if you want to collaborate or ask questions. And if you want to see what we are up to, please find us on Instagram at upstate_ruralmed. Thank you. Bye.